Hi everyone, today we're going to be talking about hypertension, which really is just a fancy way of saying high blood pressure. You have likely had your blood pressure measured when you visit the doctor's office. It's a routine test, but what exactly does it measure? First, let's go back to the basics. Your circulatory system helps carry blood around the body. Your heart will pump blood into your arteries, which take blood away from your heart and towards other parts of your body. This is similar to how water flows through a garden hose. Let's take a look at a zoomed-in diagram of the artery. As you can see, blood is flowing from left to right carried by red blood cells. As the blood flows through the artery, it also exerts a pressure on the artery wall, just like how water flowing through a garden hose will exert a pressure on the garden hose wall. In fact, water flowing through any pipe will push on its outsides and create some pressure. This is exactly what a blood pressure test measures. Aside from this, taking a blood pressure test will give a useful indication on how your heart and kidneys are working. So how do you read the blood pressure measurement? The blood pressure measurement gives you a fraction with two numbers, such as 120 milligrams mercury over 80 milligrams mercury. The milligrams mercury is the unit used to measure pressure. The top number, called the systolic pressure, reflects the amount of pressure on your arteries when your heart contracts. The bottom number, called the diastolic pressure, reflects the amount of pressure on your arteries when your heart relaxes. Systolic pressure is measured during systole. During systole, your heart contracts, your blood pressure rises, and your blood moves out of your heart along vessels. Diastolic pressure is measured during diastole. During diastole, your heart relaxes, your blood pressure falls, and your blood fills your heart. So how do you know that you have high blood pressure? You may not know if you have high blood pressure, since there are no clear telltale warning signs. The condition is often revealed through a routine measurement. This can be done at home or in a doctor's office. High blood pressure is defined as having the top number, the systolic pressure, be 140 or greater, and or the bottom number, the diastolic pressure, be 90 or greater. Hypertension is due to the narrowing of your arteries. In a healthy artery, the artery will have a large diameter, low blood pressure, and blood flowing through it easily. On the other hand, plaque and various fats clog a hypertension artery. This causes the hypertension artery to have a small diameter, high blood pressure, and blood having a hard time flowing through it. Having a high blood pressure reading means that your heart is doing extra work to pump blood through your body. After a while, this extra pressure not only harms your blood vessels, making them stiffer and more narrow, but also damages your heart, brain, eyes, and kidneys. Here are some shocking statistics on high blood pressure from the U.S. Center for Disease Control. High blood pressure is an extremely common problem in the United States. About 70 million American adults, 29% of the total adult population, have high blood pressure. That's an astounding 1 out of every 3 adults. Only about half of the people with hypertension have their condition under control. Not keeping your blood pressure under control is very dangerous, and you should consult with a doctor as soon as possible if this is the case. Hypertension costs the nation $46 billion each year. This total includes the cost of healthcare services, medications to treat high blood pressure, and missed days of work. Hypertension is sometimes called the silent killer because there are no symptoms or warning signs. Damage to the heart and coronary arteries, heart attack, heart disease, congestive heart failure, atherosclerosis, stroke, kidney damage, and vision loss are just some of the many problems that can be caused by untreated hypertension. What are the risk factors for developing hypertension? Unfortunately, there are some risk factors for developing hypertension that cannot be controlled, such as age, heredity, and gender. However, there are also many risk factors that you can control. Obesity, smoking, heavy alcohol consumption, eating too much salt, stress, and low physical activity are all factors which you can control that contribute to the development of hypertension. If you already have hypertension, there are a few simple steps you can take to manage it. First, comply with all medical prescriptions. Make sure you're taking all the medications you're supposed to be taking. Next, measure and record your blood pressure regularly. You can buy a home blood pressure monitor to do this. Finally, always follow your doctor's instructions. There are also many effective ways to prevent hypertension. You can reduce your salt intake, exercise regularly, avoid alcohol and tobacco, and manage stress. Implementing these simple lifestyle changes can help you prevent hypertension and live a happy and healthy life.